I just want to introduce Dr. Dinner. I'm sure everybody knows Dr. Dinner very well. But Dr. Dinner runs a functional medicine clinic called the Be Young Clinic here in Ramat Beit Shemesh. I have the pleasure of being his nurse and medical coordinator, along with Abigail Klatch, who is our administrative director, and she does all of our intake. And we also have a lovely nutritionist on staff. Her name is Judy Kaiser, who is, unfortunately, she's not here with us tonight, but she is wonderful and a big part of our clinic. So I just wanted to introduce all of us. Dr. Dinner began we sort of began a year ago with real taking an active interest in this area of metabolic health, as it is the foundation of a lot of the programs that we do here in the clinic. And we have a variety of tools, and Dr. Dinner is going to speak to us tonight about the importance of metabolic health and things that we should all know. And after that, I'm going to tell you a little bit about some of our programs that we offer in the clinic and how we can support your metabolic health. So I'll turn it over to you, Dr. Dinner.
Thanks very much. Good evening, everybody. Good to be here, and I really hope it will be useful tonight. So we'll go right into the three big questions, which I'm sure everyone wants to know the answer. Firstly, is it good to take these shots to lose weight? Is it good for us? That's number one. Number two, is it safe to take them? That's another good question. And the last one would be, can we ever get off them? Because everyone's fearful we're going to start these things and they're expensive. And then what are we going to do about it? Because we're stuck with it forever. So hopefully we will try and answer these three questions as we go along. As Shoshana mentioned, we do essentially what we call functional medicine. And functional medicine is quite interesting because we really look at the foundations of health. We look at the different metabolic processes that go on in our body. So when we look at a medical problem, we're not looking at a diagnosis and a drug to treat it. We're rather looking at the basic problem, what's causing it, what's the cause, and we try and fix up the cause. So we're looking at metabolic health. Metabolic health means that the body is efficiently working. It's making energy efficiently, and it's keeping our cells healthy and youthful, and our body is working in a good way. That requires many, many systems to run in smoothly. So we've got to have, for example, glucose metabolism has to be good, the metabolism of sugar and glucose, and lipid metabolism, and keeping inflammation under control in the body, and eliminating toxins from the body. All of these functionalities have to be running in a smooth way in order for us to prevent chronic illness and to live longer. And that really is the purpose of what we would like to be. So when we talk about weight loss, we have to think of it in context of metabolic health, not just losing weight, because that's an old-fashioned concept and it's not a healthy concept. In fact, I think if everyone remembers, in maybe not everyone, a lot of people weren't around who may be even present, but about in the 1960s or 70s, there used to be a model called Twiggy. And Twiggy was very, very thin. She was Twiggy. So she became very fashionable. And she changed the whole paradigm of what beauty is all about. And we all thought beauty is to be very, very thin. I don't think she lasted very long. I don't think she lived very long, Twiggy, and I don't think she was very healthy. And as a consequence, a lot of people got onto severe dieting, even to the extent of anorexia becoming a massive problem, because our concept was to be very thin. And I think it's flawed and it's old-fashioned, because the dieting essentially used to be restriction. So it's either caloric restriction, reducing calories. So we've got to go on to 1,000-calorie diet. So we lose weight by restricting calories. It could be a type of food restriction, maybe carbohydrates and glucose and sugars, restricting that and going on a keto type diet, or maybe restricting fats. All of these diets are restrictive. They work. in the short term, but we know they are not sustainable. They do not work in the long term. So why don't they work? There are a number of reasons they don't work in the long term, because essentially they're not working with the metabolism of the body. So there's certain things that we need to know about the body, which I'm not sure how many of us really know about. So for example, there are two hormones that exist in the body. That one is called ghrelin, which is called the hunger hormone, and one is called leptin, which is called the satiation hormone. So when we're in a starvation mode, when we're in depriving ourselves of calories and our brain needs more and our body needs more, we're going to produce more ghrelin. It's a hormone that is produced by the body. We don't even know about it, but it makes us hungry. So if we're always in denial and in deprivation, we're going to have excess ghrelin. And what we need to have is a balance between the ghrelin, which is a hunger hormone, and leptin, which is a satiation hormone. When we're out of balance, it's not going to be easy to maintain a diet. And so when we're in a restrictive diet, we're going to have imbalance of those hormones, which makes it very, very, very difficult to maintain a diet. The other point is that we're relying on willpower against biology. The brain needs a certain amount of calories to continue, and it's fixed for each person with a certain amount of calories. So we're always in a state with dieting, in a state of denial, and it's difficult, and we get an abnormal psychology. It's a dieting psychology. So when we go, for example, a bigger person goes to a wedding, they're never eating because they're always in denial, and it's difficult, and food is a battle and it's a fight. Whereas the thinner person's eating their chocolate mousse and enjoying the wedding because they're at peace with food. They're not fighting food. They have a peaceful mode of how they can deal with food. So they're not in a battle. The other thing is when we have caloric restriction, our metabolism slows down. So the less calories we eat, the slower our metabolism goes. So we're going lower, 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 eating less, less, less. Metabolism working slower, we're burning less calories, and we're not losing weight. We stop losing weight. So all of these reasons will make the classical dieting very, very difficult and almost impossible to maintain unless we put into place a program that works with our body. It works with our psychology. It works with our physiology. And we will try and explain this for the program that we offer and the use of these shots and how we would work with our physiology. So essentially, we need to maintain weight loss. We need metabolic support, which means working with the hormones in our body. And this is where sometimes you'll see, as I'm going to explain in detail, where these hormones, which we've discovered, the GLP-1 agonists and the GIP agonists, play a very big part. Amazing discovery. We need lifestyle redesign. We have to change our lifestyle. The people who only use shots and think they're going to lose weight and maintain weight loss without a lifestyle redesign, they're going to fail. We need muscle preserving exercises. Without that, it's not going to work. We need continuous behavioral strategies for the long term. So we change and we start enjoying being healthy, and we start enjoying eating healthy, and we start enjoying doing exercise so that it's sustainable in the long term. We need stress management and we need sleep management. Without a broader program, nothing's going to work. So having said that, let's just get a bit of an understanding of these interesting hormones. So first of all, what is a hormone? A hormone is a substance, a molecule that's produced in a gland, and it's sent off through the blood system to all different tissues in the body, and it fits into the cells of different tissue like a jigsaw puzzle. So the hormone goes along, and there's a little place in the cell that fits exactly for that hormone. It's a receptor for that hormone, and it fits in there, and then it gives a message to the cell. And then the cell will do a certain activity or functionality, which is what we need. So these two interesting hormones, one is called the GLP-1 receptor, and the other one is the GIP agonist, receptor agonist, have, as I said, receptors in all different parts of the body. They center around and they're attached to different tissues in the body and parts of the body, and they give messages. So let's see what they do. The GLP-1 it's produced in the small intestine by cells called the L cells, and there are receptors, first and most important, on the pancreas, because what it does on the pancreas, it stimulates the secretion of insulin when we have increased glucose, when we eat stuff that's converted to glucose, carbohydrates, sugars. It increases the glucose, the insulin, which metabolizes glucose, makes it into the cells and reduces the glucose in our bloodstream. It's therefore very, very effective for diabetic management. It's an excellent treatment for diabetes. It's interesting, though, that a lot of the older diabetic drugs, they will reduce the glucose by increasing insulin, but they can go too far and cause hypoglycemia. So we get very low sugars, which is dangerous. These drugs do it much, much less. They virtually do not cause hypoglycemia, which is great. So even people without diabetes can use them, and they don't have to worry that their sugar is going to get too low. They also work on the stomach receptors, and they cause slow gastric emptying. In other words, the movement of food through the stomach is slowed down, so a feeling of fullness occurs quicker, and it lasts longer because the food is moving slower. So we feel full, and we don't have to, and we stop eating sooner. It works on the brain, the hypothalamus in the brain, where it increases satiation. It quietens. People tell you that they used to have this food noise. They're always busy with food and thinking what to eat and when to eat and more to eat. It quietens things. Food's not so important anymore once we're taking this drug. So it's very, very, very effective in terms of quietening down what we call the food noise. And it even has receptors on the cardiovascular system where it improves the endothelial functionality. That's the GLP-1s. The GIP, that's another hormone. The one is more, GLPs, I'll explain that we have drugs that are exactly the same as GLP-1 made by the body, and we have drugs that are a combination of GLP-1 and GIP, which work exactly the same as these hormones. So you're adding this combination of hormones to do the same kind of thing that these hormones do. So the GIP also stimulates insulin, so it's good for diabetes. It's good for fat metabolism. It may have an effect on bone metabolism, which is good, and some may have an effect on brain. So the one drug, the GLP-1, is called semaglutide, which is the Wegovy and Ozempic, which you've all heard of, I'm sure. The Wegovy, Ozempic, we use a lot of those. And the tirzepatide, which is Mounjaro, and in America it's called Zepbound. That's a combination of GLP-1 and GIP, and that actually has better effects both on diabetic management, on weight management. We found that the combination drug, the tirzepatide, is actually better for all of the above. So if we look at the overall benefits, just to go through that, they found as they go along with these things, more and more benefits are showing up. Very interesting. The first thing, obviously, is on blood sugar regulation. As we mentioned, very good for diabetes management, for insulin resistance when people are becoming pre-diabetic. Excellent drugs for use for that. Excellent for weight management, slows down the gastric emptying. It decreases the food noise, very good for weight management. It has cardiovascular benefits. We found that major cardiovascular events are much less with people taking it. Heart attacks, stroke, all of the above are less, have been found to be less with people on these drugs. It's very good for reducing even visceral fat when fat is distributed around the organs, the internal organs, very unhealthy, and it helps to prevent that occurring. And it helps quite a lot in terms of preventing fatty liver or non-alcoholic fatty liver, which means we always used to think alcohol was the culprit for causing liver damage, which goes on to cirrhosis of the liver and irreversible damage. But now we know, even with non-alcohol, with poor diet, poor eating, excess fructose eating, excess unhealthy eating, we get fatty liver, and it leads on to sometimes even irreversible liver damage. And we know that these drugs help even for fatty liver. We have also a neuroprotective effect, which is very interesting, that it supports the health of the neural cells, the cells of the brain, and it prevents inflammation in the brain, and it may prevent Alzheimer's, and it may even prevent Parkinson's. They're getting evidence that it's very good for brain health. It has anti-inflammatory effects, arthritis, joint pains. It helps sleep quality. It prevents or helps for addictive behavior like alcoholism. And they've even found lately that it may decrease certain cancers, particularly liver cancer, pancreatic cancer, and colon. Colon is the most obvious that they found that it may have an effect in preventing colon cancer. So amazing effects or beneficial effects of these hormones, which are now deliverable by shots, and it seems like a non-brainer. You have to use it. Well, there are some side effects, mainly gastrointestinal side effects. People get constipated. Some people get very constipated. Can cause nausea, can cause diarrhea. The GI effects are most obvious. Some people get headaches. There is a possible link with a type of thyroid cancer called medullary cell thyroid carcinoma. It's not sure, but it could be. So people who have history, family history, their own history, where there may be suspected potential for that, we would be cautious using it. And there could be a possibility with causing pancreatitis, which is inflammation of the pancreas. So people who've had a history of pancreatitis, we would be very cautious. So side effects are relatively minimal. Benefits are relatively great. Now, the next question is, can one stop it? So let's say we've used it now for a year. We've achieved a good weight loss, and we're happy with our weight loss, and we want to stop it. So there are two categories of people. Those people who have adopted a lifestyle management program with it, which is Shoshana is going to tell us about that. Those people may have a fairly good chance, certainly in weaning down to lower doses and being maintained on very low doses, because we find that even with low doses, they have quite a good effect in maintaining weight loss, and also the other benefits of this. So it's a very high possibility that one can wean down, and maybe sometimes those super people who have really changed their lifestyle could even stop it. What about the people who don't do that? They just use the drug, go higher doses, and get to maximum doses. They may achieve their desired weight, but then they want to stop it. Those people are going to gain all of their weight again, and maybe more. They've lost muscle bulk, they've lost fat, but when they regain weight, they're going to gain fat tissue, and they're going to gain more than they lost. So not advisable. Those are the people who are going to remain with it forever. So the bottom line then would be, should we use it or not? And that is what a lot of us are here to hear. I think the first easy people to decide would be people with comorbid problems. In other words, people who come in, and we have a lot of them, they have a fatty liver, they are pre-diabetic or certainly type 2 diabetes, they've got arthritis, and with their overweight are not managing to walk, and there are other comorbid issues that are making them unhealthy, and their metabolism is not working well. They may be very, very fortunate and may be very good for them to use these drugs because they have so many good parts to them. The people who are generally healthy, metabolically healthy, blood tests are excellent, no insulin resistance, and they're in good shape, but they're overweight and they really want to lose weight, and they've tried and they've been through the usual, like we mentioned, dieting syndrome, and it's not working, and they're even doing healthy dieting kind of situation, and it's just not helping. We have found it is a game changer. Those people who really are carrying the extra weight, they're not feeling healthy with it, and they're not moving in any other way, and they're trying to be healthy anyway, and it's just not going. When they get onto this, and the way we use it, and Shoshana will mention how we start very low, low doses, they do very well. It's a game changer for them, and they start losing, and it makes all the difference. So it's very interesting for them. Now, bear in mind why we use it in our clinic, because we only adopt what is healthy, hopefully. Is that we are involved in functional medicine. And functional medicine means that we work with the metabolic processes in the body to fix things up from the root. We don't buy into other things. So in conventional medicine, they will say, what's your problem? Make a diagnosis and find a drug. That's how we work in conventional medicine. When you tell them, maybe let's try something alternate, maybe some supplements which may be good, berberine or curcumin. No, 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 no. Don't tell me about that. It doesn't work. When we go to complementary medicine out of the conventional system, and we tell them we're going to use a drug, don't touch it. It's chemicals. Only natural, please. I don't want to hear a drug. So you have people who may have dangerous high blood pressure, and they say, but you got to take something. No, I don't want a drug. I don't want you to be dependent on chemicals. But they're wrong, because even in conventional medicine, there's a wisdom, and they're breaking codes. And when we break a code which works with the body's physiology, and it works, then use it. And there's some very good antihypertensive drugs that are for hypertension that are very good for you, and they save lives. And they're very good. And this is an example of a chemical drug which is copying a hormone in the body, which happens to fix up a lot of metabolic problems that go wrong in the body. It happens to work, and it happens to be healthy. So that's why we have got into this field. We don't do things that are not healthy. And even in conventional medicine, there's some very good medication that work and are useful, and do not be afraid of it. So our take on it is, if it's relevant to people, it's good. And only if it's done in the right way, it will be useful. So I'm going to now hand over to Shoshana, who'll tell us about our program. And then if there are questions at the end of it, we hope to be able to answer the questions. Shoshana, over to you.
Okay. Thank you. Thank you, Dr. Jenner. Thank you for that information. That was excellent. Um, I hope everyone gained from that. And certainly, if have any questions, anything that you want to ask about, we'll have time for question and answer at the end. Um, I want to talk to you a little bit about how this clinic sort of came about and a little bit about also my personal investment in it. So Dr. Dinner and I have been working together for many years, and it was before these drugs even came to market. And a very, very large part of my work in the clinic has been supporting patients through lifestyle management. And despite our best efforts, despite incredible work on the part of my patients, no matter the support that we've given, no matter the tools that we've tried to impart with people, there have been some real limitations at times to people's success with their lifestyle management. And I think that one of the things that really became a passion project for me was helping people with behavior modification. So a couple of years ago, I decided to go back to school and to supplement my work with Dr. Dinner, learn about therapeutic engagements and counseling. And I had the opportunity to do a very large research study on this class of drugs, these classes of drugs, these anti-obesity medications, and look at them in the setting of behavior modification versus not behavior modification. One of the complaints that Dr. Dinner and I often get in the clinic is, I tried that. My endocrinologist put me on it. I felt sick. I went on it for a month. I went off it right away. I had horrible GI upset, and my stomach was a mess, and I couldn't eat and things. And I would ask patients, did anyone ever talk to you about how you should change your lifestyle while you're on these drugs? And they 100% of the time said, no, no one ever mentioned it. Are you supposed to change your lifestyle? And I would say, wow, this is huge, because the foundation of using these medications is really as a tool. When they were developed, when they were studied, they were always researched in the setting of behavior and lifestyle modifications. Okay, so I'm going to separate those into two things. Lifestyle modifications means diet and exercise. It's important to learn a new way, to have the education, to have the tools, to learn the correct diet, to learn the correct exercise protocol, to learn all the requirements. And we really try to impart that very, very strongly in our patients that come to the clinic. We have lots and lots of tools that we give people, starting with long information sessions, lots of infographics, tracking tools, online platforms, wearables. We want people to get information about how much they're moving. So recommending different kinds of tracking watches and things like that. We really invest a tremendous amount in giving people the education and also the accountability that they need to stick to a protocol. The second thing that we talk about, and that's really lifestyle. So that means diet and exercise. Okay. Now there's something much, much deeper there, which is sort of category two, which is behavior modification. This is something that is oftentimes never even addressed in many offices. And you go to see an endocrinologist or a family doctor, and people never really have the opportunity to open up about what some of their food behaviors are, and maybe what some of their less than optimal behaviors are, whether it's portion control, whether it's eating at night, whether it's eating for stress or to be able to go to sleep, or social eating. So it's really important to get to the foundation, to get to the bottom of some of those food behaviors and learn a new way of being. These medications are not a magic bullet. You can work against them or you can work with them. I always tell people that it's always a trial when we go on them. And what they're really meant to do are support you in really implementing the changes and kind of beginning the initiatives that we want you to see. So Dr. Dinner and I together kind of put our thinking caps on and said, how can we create a program that is going to give our patients all the education they need, all the support, all the accountability, so that they can really use these medications safely and effectively. So what we did was we created an 8-month program. we would like people to understand sort of the perspective of the clinic. It always begins with an intake to our clinic. Then after that, we kind of accumulate a large amount of labs. This is a medical program. We want to know that we're using these medications safely. So we always do a very, very thorough background investigation before people come to us to make sure that they're good candidates for these medications. You have an initial meeting with me. I'm the nurse and medical coordinator in the clinic. Um, so what we do in these first initial meetings, we meet once a week for a full month, and we are going to do all the background knowledge. We have to make sure that you're up to speed on how to eat, what to eat, when to eat, why to eat, all of your exercise, your tracking devices, and we do a really, really deep dive to make sure that you are current on the most cutting edge research, that you understand how you need to live and to eat for these medications. We start with a microdose. We start with a fraction of a dose. And then we do dose adjustments weekly to make sure that people are staying on the lowest effective dose, that they're not going up just because the drug manufacturer said, this is our dosing schedule. You're an individual, you should be treated as such. We do side effect management, symptom management. If you're struggling with any of the side effects of the medication, it doesn't necessarily mean you have to go off. A lot of the side effects can be managed very effectively. So in this 8-month program, you're going to meet with me for the first month every week. We're going to spend a lot of time together. I hope you like me. We are going to make sure that you meet with our nutritionist in the first month and get a customized food plan, that you understand sort of the rules and then how that applies to your life. What are the general larger principles that you need to be eating with on this medication? And then how does that work for you? Do you have food allergies? Do you have food sensitivities? We're here to support that. We want to make something that's going to work for you. We're going to make you a personalized macronutrient profile so you understand what are your calorie goals, what are your protein goals, what are your fat goals. We want you eating up to your goals. Um, you're going to be meeting with Dr. Dinner regularly. You have 3 meetings during this 8 months protocol, and you're going to also, if there's more intervention needed throughout, we can always, adjust accordingly. We repeat labs in this program every 3 months to make sure that we're seeing good movement in your metabolic health. We want to see improved glucose control. We want to see improved cholesterol. We want to make sure that inflammation is decreasing. We're going to check all of these markers. Like Dr. Dinner said, there is value in conventional medicine and there is value in functional medicine. The best value is combining these two things. So using all the tools that are available to us in our toolbox to the max, and that's really what we're trying to do here. What we want to do is get patients into better metabolic health, really see an improvement in their metabolic health using the lowest therapeutic dose. We can use both Wegovy or Mounjaro. We also have programs where people come and they're not using either of these medications, and we're happy to support that as well. Sometimes people decide during the program later on that they want to start a medication like a GLP-1 or a GLP-1 GIP. Um, I'll help support you through all of the hoops that you have to jump through via the COPA and talk about cost benefit and dosing. All of that is included in the program. Um, and what we do is really try to get people to achieve their goals, help them to wean off medication safely and effectively. And for many people, this is going to be what we call a long-term medication, something between 1 and 4 years. So this is really the building blocks, is learning the foundational pieces, learning the lifestyle modifications that need to be implemented, the behavior modifications that need to be implemented, and then hopefully people can reach their health goals and improve their metabolic health. We have 2 options for these programs in the clinic. One option would be what we call the online lifestyle transformation. Not everyone has the opportunity to come into the clinic regularly and have more extended meetings with me. Some people need accountability, but they want it in a more bite-sized kind of format, forgive the pun. But what we want to do is make that accessible to them. So in one program, what we can do is online check-ins where we have our first and second meetings in the clinic, and after that, we'll have check-ins by phone. Those meetings are a little bit shorter for people who have less time free in their schedule. So that's one option for the program. The second option is for people who really want to do some deeper behavioral work and need a little bit more support and a little bit more interaction, who have a little bit more time on their hands. We have another option where we have longer meetings. The meetings would be in the clinic and they're a little bit longer, 30 to 40 minutes per meeting. And hopefully, in that, we can answer all your questions, give you all the support you need. I'm always available by WhatsApp, by phone, by email during clinic hours for patients on program. So if you ever have any kind of issue with your, let's say you're having an issue with your medication pen or prescriptions or side effects, you have someone to talk to. There's an address to be reached. So that's really the protocol that we're working under. I would really like to open it up to your questions. As you know, it's kind of an odd experience to just talk on Zoom and then not see people's faces or hear their engagement. So, okay, we have a question here about the program. People want to know how much they cost. Okay. Um, so someone wants to know, is it safe to be on these drugs long term for someone who struggles with food addiction or compulsive overeating their entire lives? Um, so this is what we say. These are long-term medications. We always want to use what is considered the lowest therapeutic dose. That means the dose that's effective, but trying to keep it low. We don't go up and up and up. Um, these medications have actually been studied for many, many years. I know these seem like new medications, but they've actually been in development and used in treatment of diabetes for many years. Dr. Dinner, maybe you want to answer about the safety and long-term
Yeah,
use.
I think it's as we mentioned before, the safety or benefits will far outweigh the side effects, and it's when we're using a drug or a chemical that's actually made by the body. It's the same thing that we produce. It's nothing foreign to the body. It's not a chemical drug that's foreign to the body. So you're giving what the body uses anyway, and
Mhm.
therefore it has a high safety level, and it's even safe in the long term, and it may be safe in the very long term because it may be what people need. There's certain people are deficient in these hormones, and when you give it to them, their body starts working correctly, their thinking starts working correctly, so we can use it in the long term. That's quite important. What is the other question?
Great question. Other question is, okay, I think this is might be for me. How much does the 8-month program
Yeah,
cost? So
yeah.
there are two options. The online program is an 8-month program and it is 600 shekels a month for 8 months. If you would like to do the longer program with longer meetings, that program is 725 shekels for 8 months. The medication cost is separate. The medication cost is determined heavily by which coupa you are on and which comorbidities you have. So, someone who's diabetic or has significant other comorbidities like hyperlipidemia, hypertension, a thing, any kind of metabolic disease, not just like a high BMI. They often qualify for any sure, and then they get the medication at a discounted rate. There's these medications can be prescribed through your doctor on the Coupa, and Dr. Dinner does. We always recommend that people use these medications in the setting of support and education. When these drugs were developed, they were given to the power of prescription was given over to endocrinologists and cardiologists and family doctors. Um, but if you look at the recommendations from the manufacturers, it says that these drugs are meant to be used in the setting of support, education by your family doctor, your nurse, your nutritionist, a counselor. So we always recommend that people get the proper education so that they're using these medications safely and effectively. We understand that there are limitations, financial limitations, and things like that. If you need, your family doctor through the Coupa can prescribe them, but what I've seen in my just lived experience is that oftentimes people, they're not as effective for them. They have terrible side effects. They end up going off of them, and then they are in a much worse place than when they started. Like Dr. Dinner said, if you don't use these drugs properly, you really run the risk of losing lean muscle mass. It's not only the lean skeletal muscle mass, it's also your heart is a muscle, just the way your biceps are a muscle. People can do cardiac damage. They can have, obviously, what I'm sure you've all seen in the news, which is a very kind of sad side effect of these, is people get what's called Ozempic face, where they become very wasted looking in their cheeks and in their temples. And that is just a loss of skeletal muscle mass. So just like Dr. Dinner said, when people like who go off these medications, who have been using them in that way, um, they often regain the weight actually much more and much more quickly, and the proportion of fat to muscle regain is definitely skewed. They're going to gain a much higher proportion of fat. So, um, I would encourage everyone who wants to use these medications to get the right education, the right support, and have the right management of doses and side effects. Um, so we have another. I hope that answered the question. We have another question here, Dr. Dinner, about potentially being a long-term solution. What about people in their 30s? So can men and women in their 30s go on these medications?
Yeah, I think that certainly can do. Again, if there are comorbid problems like prediabetes and fatty liver, all the things we mentioned, it would be very relevant for them. Obviously, at a younger age, we would try to do lifestyle management without them. But some people, it depends, and it's a wide range, have severe metabolic issues. So we would be more selective, and if they have the more severe metabolic stuff, we would encourage them. Obviously, one issue is a woman cannot be pregnant while taking them. So if she's in that period of her life, she would not want to take this medication. But otherwise, depending on the severity of the other metabolic issues, you could certainly start at a younger age. Just want to add a little bit about the lifestyle program and support. Is not the aim of this program in the end of the day, and that's the key to any lifestyle success, is you have to start enjoying it. We don't sustain anything we don't enjoy. So the
Mhm.
whole purpose is using these drugs because they help, and using the program to get to the position that you start enjoying being healthy. You like to eat healthy, you like to be fit, you like to be firm. We're not looking at thin, we're looking at firm and strong and healthy and metabolically healthy. And by the end of it, you're hooked on it because you like it. And that's the aim of our program in the 8 months. And that's why with Shoshana, I think we've had a high success. Thank God.
Again, yeah. I'd love to open up the floor. Does anyone else have any questions? You're welcome to post them to the chat, or if you'd like to ask, I'm happy to
Mm.
take questions. Um, okay. If one doesn't have comorbidities, can you give an idea of the actual cost of the medication itself? Yeah, absolutely. Um, okay, so this is like hitting a moving target, but I'm going to explain sort of the cost of the medications via the coupa. Um, a 1 milligram pen of Wegovy, which is a GLP-1, the cost is 578 shekels. Now that pen is a click per dose pen. So people are able to adjust it on their own and do what's called micro dosing. Okay. The idea is that you can stretch the pen a little bit longer, so you can use it a little bit longer. Um, so that would be the cost of a GLP-1 initially. If you go over a certain dose, let's say someone is kind of increasing their dose and they need to go to the next pen. The next pen is called a 1.7 milligram pen. That pen goes up in cost to 940 shekel. Similarly, they keep increasing their dose. the next pen would be 1,250 shekel. Um, what I see is that patients that need to increase to that dose will switch to a more effective drug, which is Mounjaro. Wegovy, which is semaglutide, on average, people lose about 15% of their body weight. With Mounjaro, on average, people lose about 20% of their body weight. Mounjaro, for someone with a BMI over 30, is covered at 50% via the Kupot. That means the full price of the drug, for the lowest two doses is 1,650 shekel. And you would pay 50% of that. So about 825 shekel. Okay. Um, that is with, you have to go and see a nutritionist on the Coupa twice every 6 months in order to maintain the Eshore on that medication. And that's very similar that's for Mujeres. Maccabi has a slightly different system, but the discount is also offered. So that's the idea. I hope that gives it obviously is dependent on the dose. It depends on how long you would stretch the pens out. But those are sort of like round numbers to give you a general idea. Um, Someone asked about osteoporosis and celiac. Dr. Jenner, do you want to take that? If someone
Yeah,
has,
so I think there's a position that certainly the GIP-1, the Mounjaro, may even help for treating osteoporosis. There's a chance that it increases the functionality of what we call the osteoblasts. Osteoblasts are the cells that build bone in the bone, they build bone, and it decreases the activity of the osteoclasts that break down bone. So there is a possibility, it's not clear for sure, that it may even be helpful for osteoporosis. There's no problem with celiac. Obviously, if one keeps a celiac diet, and essentially we want a high protein diet, we want to keep the carbohydrates low. So there'd be no problem at all with celiac. One other thing which could be true, maybe I see my son is there from Baltimore. I don't know if he's concentrating, but he's there. I can see him. But he told me, and I think it's true, that Mr. Trump, President Trump, is working very hard on making these drugs very much lower cost. The reason being because they recognize it's such a game changer in health that it's going to make a paradigm shift in the health of Americans. So hopefully he'll do it, and I think it will happen because it's true, and therefore we'll all gain by it. Now, the question is, did Tsui hear that or not? He's not registered. Fine.
I
But he told me that.
think so.
And I
Maybe
think
he's
it's
shy.
true. He's looking. Okay, sorry.
Yeah, true. It's
Were there
true.
other questions?
Um, the next question is how, yeah, so let's see here. The next question, how long does a pen last? So a pen can last four amount of time would be 4 weeks, and we have another. Oh, let's just make sure everyone can hear.
Shoshana,
Yeah.
there
The
was
next question here is that these
sorry,
medications.
Shoshana, you may have to repeat that because it wasn't clear what you said. If you could just
Yeah.
repeat that. Yeah. Yeah, you seem to be
Hold on.
freezing. Can
Sorry.
you hear us?
It wasn't clear. Oh, I'm sorry. Okay, let me say it again.
Yeah,
So
now we
these
can hear.
pens can last anywhere. Do you hear? Can you hear me okay?
Yeah, now we
Yeah?
hear. Now we hear.
Okay, sorry about that. A pen can last 4 to 8 weeks, depending on how you're dosing it, and how it's being administered. Okay. Um, the next question is that someone has heard that these pens can cause depression. Is that true? And if someone is on an antidepressant, can they take them at the same time?
Yeah, no, certainly one can take it with with an antidepressant. There are more anecdotal cases of it causing. It's not described as a very big side effect. We've seen it. We've even seen it in our clinic occasionally, but not common. I think it's not it would not be a worrisome thing to try it if one has depression and if one is using an antidepressant. I don't think it's a problem.
Perfect. Perfect. Someone wants to know if the functional medicine treatments are covered by the Coupa as much as conventional treatments, and how much the Coupot are becoming accepting of alternative or complementary medicine. That's an excellent.
Um, the functional medicine is not recognized. It's very, very, very popular in the
Would
United
you like
States.
Dr. Jenner, would you like me to
Oops.
answer, or would you like to take
Shoshana,
them?
Shoshana, I'm not sure if others are, but we're not hearing you clearly at all.
Let's see what we can do here.
Now we can
Um,
hear.
so
Can you hear me?
just we want to they know if functional medicine treatments are covered by the Coupa
No, so they're
and how
not
much
at
the
all.
Coupa are becoming accepting of alternative or
So
complementary medicine.
the functional medicine has not arrived in Israel as yet. In any of the Kupat Cholim. It's very, very popular and spreading amazingly in the United States and other countries. Hasn't reached here in a strong way yet, and is not acceptable, not paid by the Kupot at all. I think there are some other alternative clinics in the Kupot that they are covered, but not functional medicine. No.
So we have another very good question. For someone who's bedridden and not able to do exercise, um, they want to know if Mounjaro would be a good alternative for them. We're in the chat here over 185 kilos. What would you say about that?
So I think it's a very good question. It most probably would not be a good idea. Um, One would have to be in consultation with an endocrinologist, but it's really very, very, very important to maintain one's muscle mass and to do all the other parts of the program. I think it would be quite possibly dangerous for a person to like that. But again, it's definitely worth asking a endocrinologist on that. It's a good question.
Yeah. Thank you. Someone wants to know, what about severe GI side effects? Is there management for someone who has severe GI side effects?
That can be a problem if there's severe reflux, esophageal reflux. There can be a problem with that. There can be some people with irritable bowel syndrome, increasing gassy and malfunctioning intestinal tract. It can enhance those problems, and one has to try. And it sometimes is problematic, sometimes not. But it certainly could make those problems worse, definitely.
Mhm, mhm. Okay, thank you. Um, I just want to make sure everyone can hear me. Sorry, I had a little blip in my internet there. I don't have any more questions on the chat, but uh, um, I'd love to open the floor again, just in case anyone has any burning questions. So someone asked, actually, this is a very good question, just coming in now. If it is okay for women going through menopause. Dr. Dinner, do you want to take this one, or would you like me
I'll
to?
take it. Again, we're not hearing you clearly, Shoshana, but I think people can hear me. So yeah, it's certainly very
Um,
possible to use in
okay.
menopause. It's sometimes very good to use in menopause. It can enhance the whole program. Again, in menopause today, we like to give other hormones, which are very important. We'll speak about that in our next talk, because even in conventional medicine, we've used it for many, many years in functional medicine. For women going through menopause, they should take the healthy form of estrogen and progesterone. But now even conventional medicine have recognized that it's very important. But these hormones, the GLP-1, GIP agonists, can also certainly be used in menopause. Very good, because a lot of metabolic changes are occurring in menopause. Things are slowing down, weight gain, all kinds of things are happening, and it may be very, very relevant for a woman in menopause.
Okay, excellent. Um, Someone asked if running blood tests is done privately or through the Coupa, and I could just tell you simply that's available through your Coupa. Blood tests are generally, depending on the specific test, blood tests are up to the doctor's discretion. Typically, we run tests about every 3 months, making sure that we're seeing improvement in your glucose, your HbA1c, cholesterol, CRP. We would like to just do kind of a wide range. We like to make sure that everyone's vitamins are sufficient. Dr. Dinner or your family doctor can run those tests as needed through the Coupa. Um, what percentage of people have had to go off of the drugs from the clinic due to unmanageable side effects? Okay, so this is very interesting. I think Dr. Dinner and I should publish a study on this. Our averages are basically identical to the national averages. When they studied these drugs, they said that they will work for about 86% of people. And that has been our experience. We have the occasion, it's always a trial when you go on these medications. And unfortunately, there have been a couple of people who have not responded well. We always try to change medications, change dosages, work with the patient. We always try to, give them the best possible chance. But it does happen that people do not have a good response to these medications and do have to go off. So nothing is 100%. Anyone who tells you this drug will work for you 100%, no question, I wouldn't believe them. That's not true, and that's not what we see. Um, okay. Um, so people want to know if digestive issues can be treated with over-the-counter medications. Dr. Dinner, do you want to take that one?
Digestive issues.
Mm-hmm.
No, possibly. There are some things that work over the counter, but you have to. It's very individualized. It's not an easy question. You have to know how severe they are. Sometimes one needs certain medication. If the stomach motility is working slower and this food is going slower through, and one has a potential for reflux, then it's going to be worse. So sometimes we have to deal with all these different issues. But sometimes, yes, we could do natural over-the-counter stuff. There was a question whether we do lifestyle management without using the drugs, and that is definitely. We have a number of people on the program without needing the drugs or who prefer not to use it, which is always a good option, because essentially, as we mentioned before, it's the metabolic changes, the lifestyle changes, the long-term changes that are the key. Some people can't do it without the drugs. A lot of people can do it, will need the drugs. Some people can do it without the drugs. So we certainly do it for people who do not wish to use the drugs.
Someone wants to know, have people from the clinic successfully weaned off the drugs and maintained their weight and healthy lifestyle? So I'd like, if it's okay with you, Dr. Dinner, I want
Yeah,
to
sure.
just speak to this for a second. So learning a new lifestyle is definitely a process. And what we're trying to do here is really create a roadmap for people that oftentimes things come up in our lives. We have we're making a wedding or it's a holiday or we're going on vacation, and we sort of veer off of our program a little bit. What we're really trying to do is create a roadmap for people to get back on track and accountability for that to happen. So people have, cut down on the medication, absolutely. I think the most important thing is reinforcing those tools and skills that when people do go off the medication, that there might be some bumps in the road. That's very, very realistic, but also that they have the tools to get back on track and they know where they're going. So that is a muscle that we have to develop. It's like the reset button muscle. So I think when people come through the program, they leave with a lot more education and a lot more skills than they came in with. There's also an address. When you feel yourself slipping, when you feel like things have gone off the rails and they're a little bit out of control, you have kind of what to grab onto. You have a lifeboat, you have a preserver. Dr. Dinner is here, I'm here, our nutritionist Judy is here, and you know there's a way back home. So that's always really important. One of the first things we teach our young children is their mommy's phone number. So I want to give that to everyone, that there's an address for people to help. I know I can't do it for you, but we're here to help you, and we're here when you need to reach out to someone. So that's what I would say. Um, okay. So not being able to exercise because someone is bedridden. So I think Dr. Dinner addressed this, right? That it would be definitely in consultation with an endocrinologist. Um, that would be a really like a personal question because we would have to assess the patient and see, what is their mobility. For some people, starting out slowly and just getting going in whatever capacity they're able to might be this might be very helpful for them to just even lose a certain percentage of their body weight so that they can get moving. That would be a really personal question that would have to be addressed both with your family doctor, endocrinologist, like Dr. Dinner said. Um, Someone wants to know, do you work with people who, yes, we work with people who need lifestyle help but do not want medication. Our Abigail, who's like our administrative director, is going to be sending a copy of the recording of tonight so people can get it. Um, the monthly cost of the program is for our clinic, and the Coupa covers all the blood tests you're going to need. So there's no additional cost for blood tests. That was another question. Um, okay. So this is another good question, Dr. Dinner. I think you're going to like this one. So going off the medication, how much weight do people on average gain? Um, they're not able to use the tools without the medication. So I think that's an interesting question. Do you want me to address this
Yeah,
one?
I mean, sure. You can answer, but I think essentially, as we
Okay.
mentioned, it's the two category, the people who will stop the medication without the continuous lifestyle management, as we mentioned, will gain all their weight and more, as we mentioned before. People who maintain a very good lifestyle change will gain much less. It's variable,
Right.
but the data shows that if you stop it and you don't change, you're going to put everything back and more. That's for sure.
Mhm. Yeah. One of the major research studies that looked at both semaglutide and tirzepatide said that on average, people, if they made no lifestyle modifications, got up to the highest dose, went off the medication, gained on average 3 times what they lost. So, and that's putting back on fat mass as opposed to muscle mass. Um, so we have another question here. What if the weight portion of my BMI is okay and I want to lose fat and add muscle to maintain the same weight?
I think that's very good. You can, I mean, again, if you're happy with your weight, a lot of that's going to be exercise. But if you're carrying a lot of excess fat tissue, especially abdominal fat, which is unhealthy, so if it's not working, then it would help. You may need to adopt these injections, but it sounds like that a person like that would want to go more to exercise, to core exercises, strength exercises, convert fat tissue to muscle. That's our aim. We want strong, firm, healthy people, not thin.
Exactly. Exactly. The BMI is it's a very tricky measurement. It's very non-specific. We try to go for more specific measurements. What we're trying to do, as Dr. Dinner said, increase muscle mass, decrease fat mass. A waist to height ratio is a much more specific measurement of that. So that's a measurement we use significantly. I think for people who are so inclined and they want to do what's called a DEXA scan to get an idea of how much muscle mass they're holding, there's an option for that here in Israel. But it's mostly important that it can be appreciated just through visualization and measurements. So people can see how much muscle they're putting on by the way their physique is changing. So I think there's what we call non-scale victories. Things like putting on your sweater or buttoning your coat and you realize, oh, look, now it buttons. Isn't that amazing?
And it's interesting, that's very important that at any age meaning any age, even 95-year-olds, we heard about the retired dentist in England who didn't like what he looked like in the mirror. So he went to the gym and he started pushing weights and he started going for sprints and he had a trainer and a coach. And then he says at the end of the talk, "Do you know how old when I started this program?" I think he was 95. So any age we can reverse and build muscle. And I'll tell you what I got from, I don't tell you which birthday it was, but my children gave me a gift. And what they gave me was a multi-trainer. And a multi-trainer is where you sit on a seat and you have all these different levers and you can do your pecs and you can do your biceps and your triceps. Oh, unbelievable gift they gave me. And that anyone can do it at any age. It's fantastic. That's what we call
Excellent,
metabolic
excellent.
health.
Yeah, absolutely. Um, Someone just asked, aside from regular exercise, is it necessary to do weights for keeping muscle mass? Yes, 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 100% yes. There's n nothing that can replace weights. Everyone needs to work at their pace, do it safely, get good instruction. Um, how much of that a day or a week is needed is a larger discussion. I think it depends on the person and the age and the gender and all kinds of other things, more specifically for you. But um, Dr. Dinner is a major, as he just told you in his own home gym, a major proponent of increasing muscle mass through weightlifting. Our body undergoes a process called sarcopenia. Every decade of our lives, we lose a certain percentage of our muscle mass. And without training with resistance exercise, that will continue. So we have to sort of fight that and increase our protein and make sure that we are doing muscle work, resistance exercise. Um, we do have trainers that we can recommend. I have if you want someone to come work with you privately, we'll talk about in the program all different types of exercise options that are available to you, from working out at home to the most personal of training sessions. We can discuss what's available in the neighborhood. Okay.
Okay.
I think we answered all the questions. I'm gonna go ahead and post this link one more time. So anybody, it's in the chat there, anybody that would like more information about the clinic, that would like to hear about our programs, that address GLP-1. We have memory programs. We have bioidentical hormone replacement therapy. We have programs that address cardiac health. We are really here for all your functional medicine needs, whatever that might mean for you. It was so nice to get everyone together tonight to speak. I'd like to just sort of offer our presence here in the community. And if anyone wants more education about functional medicine, what that is, feel free to reach out to us.